Good morning, everyone. Thank you so much for joining us. We'll let folks get settled in and we will be starting momentarily. All right, welcome again, and thank you so much for joining us for Take 10, Transforming Care for Women with Substance Use Disorders and Their Families. This is an intro session on substance use disorders in women, history, use, and treatment with your presenter, Ashley Ryan. Today's session is only a quick 30-minute webinar, so we hope that you can join us next week for our next session, which is a 2-hour webinar that will go more in depth. So today is just an intro. Today's training is brought to you by the Great Lakes ATTC and SAMHSA. The Great Lakes ATTC and PTTC are funded by SAMHSA under the following cooperative agreements. The views expressed in this training are the views of the speaker and do not reflect the official position of DHHS or SAMHSA. The ATTC network uses affirming language to promote the promises of recovery by advancing evidence-based and culturally informed practices. If you are having any technical issues, please individually message me, Alyssa Koala, in the chat, and I would be happy to assist you. Any questions you have for the speaker, please use the Q&A option of your toolbar, and we will take some time to answer those questions, or if we don't get to all those questions, we can send out those answers at the end. The recording and PowerPoint will be made available on our website by the end of the week. If captions or the live transcript would be helpful, please locate that option using your Zoom toolbar. And you will be redirected to a very short survey at the end of today's presentation. Certificates of attendance will be sent out via email to all who attended today's session in full. Stay connected with the Great Lakes ATTC. We have a Facebook page, LinkedIn, YouTube channel, and our Spotify channel. And I'm super excited to hand this over to your presenter, Ashley Ryan.
Hi, everyone. Thanks so much for joining us today. I am thrilled to be here. I love this topic and happy to present today's training, which will be a 30-minute training. And next week we have a 2-hour training, so it's a 2-part series. Today we're focusing on the history of women's treatment, and next week we'll focus on treatment, women's use, and recovery. My background is mostly in healthcare policy, compliance, and practice management. I currently have my own consulting firm, Ashley Ryan Consulting, which supports behavioral health agencies with project management, accreditation, and program evaluation. I have some clinical experience in outpatient and residential settings for both men and women. I finished my Master's of Public Administration in 2022. I compiled much of the material for this presentation for my master's research project, which revolved around women's treatment and trauma from a public lens or public administration lens. My primary connection to the disease is as an adult child. I'm located in Cleveland, Ohio, and I was director of a women's substance use disorder outpatient treatment facility for a few years. Our program provided extensive wraparound services for women, including childcare, transportation, trauma therapy, and case management. Please feel free to ask questions throughout this presentation. I know Alyssa mentioned you can use the Q&A. I see some of you have found the chat function. If we do not have time to answer those questions, we can definitely do that afterward. I believe Isa and Alyssa will be able to post that to the Great Lakes ATT website. And a disclaimer here that I do not pretend to be the expert. I know that you all have a lot of experience within the field. I just have done a ton of research, interviews, and data collection on this topic. So really excited to share that with you today. So in my presentation next week, I will provide more background on this slide and share its relationship with the treatment side of things. But for this topic today, women and substance use disorder treatment history, I wanted to include it because it sets the precedent of focusing on women and their roles they often play in families. which can be primary caregiving for children and older adults. Throughout this presentation, I highlight some women that are not as prominent as men in the field, the slower emergence of women's treatment centers, and limited research of women-specific treatment issues compared to the SUD-focused research body as a whole. So here's a snapshot of what I'll talk about today, and it focuses on women who have contributed to substance use disorder treatment and the involvement of women-focused treatment. I know there were psychiatric-based facilities for inebriates in the mid-1800s, still the movement for alcoholism and later drug abuse to be named a disease gained momentum in the mid-1930s, which was after Prohibition and at the end of the Great Depression, and aligns with Alcoholics Anonymous founding. So, starting with the founding of AA, it was founded in Akron, Ohio in 1935 by Bill Wilson, better known as Bill W., and Robert Holbrook Smith, better known as Dr. Bob. They were introduced in 1935 by Henrietta Buckler Seiberling. So quiz question here, and feel free to use the chat. Does anyone know the company that the Seiberling family owned at that time? To give you a hint, Akron is known as the Rubber City. So that should give you a big clue there. I'm going to look in the chat to see if anybody knows. Yep, Lori's got it. Johnny's got it. So it's Goodyear. Gertrude and F.A. Seiberling founded the Goodyear Tire and Rubber Company in 1910. They had 7 children. Their son, Fred, but for some reason they called him John. I'm not sure why. He married Henrietta Buckler in 1917 after meeting her in El Paso, Texas, when he was stationed there with the Ohio National Guard. They had 3 children, and they lived in the Gate Lodge on the family's property called St. Hewitt. In this picture on the screen is showing the Gate Lodge, which is located on the northwest side of that St. Hewitt property. In 1933, Henrietta was introduced to the Oxford Group, a Christian-based faith group. Henrietta became very involved in the group and spent 2 years immersing herself in the organization's teachings. She started to work on herself and engage in much self-improvement, quiet time, and journaling. She became more compassionate and understanding through her work and applied these principles to her marriage. Henrietta attempted to get Fred involved in the Oxford Group and was frustrated by his lack of interest. Over time, she let go of what she could not control and put the focus on herself. This should sound very familiar to many of us. There are rumors that Fred had a drinking problem, but there is no evidence to support that. The couple separated in 1935, so that was 2 years after Henrietta was introduced to the Oxford Group in 1933. Henrietta stayed in the Gate Lodge, the picture that we're seeing. Fred moved back to the 65-room manor house, which was a stone's throw away, and the two never got officially divorced. So I guess that's how divorces worked in 1935. So the next part is the more famous part that many of you probably have heard and part of this story. Bill W. had arrived in Akron, Ohio from New York City after a failed business deal, found himself in downtown Akron's Mayflower Hotel lobby, and did not want to go to the bar and drink, even though he was very tempted to. He found a display with names and phone numbers of various ministers. Bill called Reverend Tunks, an Oxford Group affiliate. The clergyman supplied a list of contacts, and Bill avoided calling the Seiberling name, thinking it was the great F.A. Seiberling's wife, Gertrude. Because no one would answer, he ended up calling the Seiberling name, which happened to be Henrietta. She was 12th on that list. He discovered she was the daughter-in-law of the man known as the Little Napoleon of the rubber industry. She invited him over and connected him with Dr. Bob at her house on Mother's Day, May 15th, 1935. And after 8 hours of talking, the first conversation of Spark AA took place. Founders Day is on June 10th, 1935, when Dr. Bob took his last drink. Henrietta stayed involved and helped support the foundation of AA, even though she was not as prominent in the literature going forward. Over her life, she continued to stay very involved and help lead many people to sobriety. So I love highlighting Henrietta in that portion since she was foundational in the beginning of AA. And if you look at the picture on the screen, the room where Dr. Bob and Bill W. Talked for 8 hours is on the right-hand side. So it's that room that's protruding out of the building. In 1939, Marty Mann became the first official woman to join Alcoholics Anonymous and achieve long-term sobriety. Marty was handed the original 1939 edition of Alcoholics Anonymous by her hospital psychiatrist. It was her first step towards sobriety and a long career as founder of the National Council on Alcoholism. So at this time, Marty ended up going to the one of two meetings that were in the country. One was in Akron, Ohio, run by Dr. Bob. The second one was in New York City, run by Bill W. She obviously went to Bill W.'s house since she got sober in New York. And she was the only woman there. I know Lois was there and a lot of the wives, but she was the only female there that was looking to be an AA member. I was able to listen to Marty Mann, her story, the first woman to get sober in AA on audio. It's available on Audible, and it's by the History of Recovery. It was an actual recording of her giving a lead. She is such a powerful and humorous speaker, and I can see why she was so influential during her lifetime. It's a little bit over an hour long, and I highly recommend it. So again, it's Marty Mann, her story, the first women to get sober at AA. Also, Sally and David Brown wrote Marty Mann's biography. It has some amazing, well-written excerpts that I didn't want to try to paraphrase or anything, so I'm going to read you kind of exactly some paragraphs that they have. They write, Marty Mann is scarcely a household word today, yet she is arguably one of the most influential people in the 20th century. Marty's life was like a blazing fire, but was nearly extinguished by personal tragedy. She rose to a triumphant recovery that powered a historic, unparalleled change in our society. Through her vision and leadership, the attitude of America toward alcoholism was changed from a moral issue to one of public health. This was a tremendous shift, especially considering America's long temperance history that reached the Prohibition Amendment of 1920. By all accounts, she was one of the most spellbinding speakers this land has ever seen. Even audiences initially skeptical of her message that an alcoholic is a sick person who can't be helped ended up enthusiastically supporting her. For most of her 24 years as director of NCA, she maintained a speaking schedule of over 200 talks annually. Marty's talks aim to establish local volunteer groups in every major city. These affiliates of NCA would carry out NCA's mission to provide education, information, and referral for their respective communities. In the early 1950s, Edward R. Murrow, a distinguished journalist, selected Marty as one of the 10 greatest living Americans. During her lifetime, Marty was extremely well known in the local, regional, and national press. Her appearances before state legislators and Congress were unforgettable for those present and made an impact. So there you have it, amazing Marty Mann. So next I want to cover Sister Ignatia, which many of you may also know. She is known as the Angel of Alcoholics Anonymous. On August 18th, 1939, the first alcoholic patient, Walter B., was admitted to Akron, Ohio's St. Thomas by Sister Ignatia, making St. Thomas the first hospital in the world to treat alcoholism as a medical condition. Sister Mary Ignatia was a pioneering figure in the care and treatment of alcoholics. She was in charge of admitting Akron St. Thomas Hospital's ER due to having said emotional problems and nervous breakdowns. So I think they're inferring that she was a bedside nurse and then came into admissions. This is interesting, knowing her history afterward of how many alcoholics she helped, that before she was admitting, everyone and helped people in the special ward. She was actually known for having nervous breakdowns. I thought that was interesting. And also, she is 100 pounds soaking wet. She was little and mighty. And they said she had the look of being frail. But despite these characteristics, obviously her drive and strength made her great work possible. In the 1930s, when alcoholism wasn't recognized as a medical condition, she would diagnose patients with acute gastritis and move these patients to a random room next to the hospital chapel to treat them. So it sounded like this was a very private spot hidden way on the other side of the hospital ER. Her work at St. Thomas Hospital in Akron, Ohio, was alongside Dr. Bob Smith, who, as we know, is the co-founder of Alcoholics Anonymous. This led to the establishment of the first hospital ward dedicated to treating alcoholism. So it was Sister Ignatia who introduced the custom of giving tokens to recovering alcoholics to mark their sobriety. She gave her patients a sacred heart to remind them of their commitment not to drink. Sister Ignatia's compassion, yet unconventional approach of admitting alcoholics under false diagnoses and offering care eventually paved the way to recognize alcoholism as a condition requiring medical treatment. Throughout her career, Sister Ignatia directly helped over 15,000 alcoholics and another 60,000 family members, leaving a lasting impact on the recovery movement. And, I think I talk to maybe a few hundred people a year. I don't know about you, but it's pretty amazing. And I know in 1952, she was moved up to Cleveland and at St. Vincent and opened up Rosary Hall. And I guess up until her death in 1977, just a year before her death, she was still seeing patients and helping families. So I think the lives that she touched, especially Northeast Ohio and anywhere else that they moved in the United States, is remarkable. Right. The first women all group was started in Cleveland, Ohio at 1941. This was the West Side Women, and it was in Rocky River, Ohio, which is just on the west side of Cleveland, right on the coast of Lake Erie. Even though more women began to join AA after this point, AA was mainly a group for men. Addiction was a man's disease, and their wives would attend Al-Anon. The stigma of alcoholism being a man's disease also aligned with women entering the workforce from 1930 through 1970s. Women can still drinking much better at home than men drinking in public or at work. So thinking about women-focused treatment centers, as I mentioned before, there were a few specific institutions that were asylums or drying up facilities that popped up in the mid 1800s and the early 1900s that were for women only. But it was a very small portion of those institutions. Women-focused treatment that looked more like what we know today really started opening up in the 1950s. In the 1970s and 1980s, the women's alcoholism movement occurred, allowing treatment providers to focus more on women's needs. The focus on women was in response to the crisis of drug-exposed infants at this time. In 1982, the prior First Lady, Betty Ford, opened the Betty Ford Center in Rancho Mirage, California, bringing unprecedented visibility to addiction treatment and recovery. She was very open and transparent about her recovery journey, which helped to set the stage to fight stigma in our communities. And if anyone remembers or was alive during this time, you may remember that Betty Ford was very open about her breast cancer journey while she was in the White House, and definitely has a heart for social service justice. By the mid-1990s, there was only modest growth for women-only substance use disorder SUD treatment caseloads. In 1992, the first women's drug court opened in Kalamazoo, Michigan. This was 3 years after the first men's drug court opened in Miami, Florida in 1989, and this coincided with the US crack cocaine epidemic. So looking at today, and I know I'm jumping ahead a little bit, but SAMHSA's National Survey of Substance Abuse Treatment Services report in 2020 shows that as far as availability of treatment options for women and men, we are equal footing right now. So I think that speaks a lot to the work that we've done over the last 40 years to get up to the same level. And this does, if you look at the state report, it pretty much coincides state by state. They're pretty even. So 2000s to today. And, I really love the tip 51. I'm sure many of you have that or have been into it, but it has been updated 5 times since its initial print in 2009. Some of the most prominent research we have are by Green in 2006, Saxena, Prida, and Racina in 2014, Sugarman in 2018, Meyer, Riley in 2020, and Greenfield has a few publications, 2013, 2018, 2020. There are a lot of different curriculums that have come out in the last 20 years, which I'll go into more in depth in the training next week as part of the treatment realm. By 2012, we know that there were published protocol for medication-assisted treatment, which has helped many women and pregnant women have safer deliveries. Also around this time, the digital age really allowed the use of behavioral health via telehealth, which exploded in the 2020 COVID-19 pandemic. There has been increased research in women's needs and more available places to get help in the last 30 and 40 years, as we saw in that SAMHSA report 2020. However, we have much more headway in providing quality, evidence-based, trauma-informed, and comprehensive care for women in need of substance use disorder treatment, especially those that may already be in a cycle of poverty or subject to systemic racism. So we know that trauma-informed care is important in both women's treatment and men's treatment. But next week I'll address kind of going through that, and women's treatment is just a little bit more complex. Women have a lot more complexities usually due to their role within the family typically and biologically. So that is all that I have today. We did get done a little bit early. Here is my contact information. I think we may try to go through a question or two if we have anything. But here is my contact information on the screen if you'd like to jot it down and send me a note that way. Thank you all so much, and Great Lakes ATTC, thank you so much for having me today.
Thank you, Ashley. Just a reminder, if anyone has any questions, please feel free to put those in the chat or in the Q&A section. As you are all starting to think of different questions that you may have, I did put a few notes and reminders in the chat for you. Please make sure you take that post-event survey. It does allow us to continue to provide free trainings to you all. It should only take about 2 to 3 minutes, so please make sure you click that link. You will also be redirected as you leave today. Our 30-minute sessions during this webinar series will be you will be receiving certificates of attendance. Those will be sent out via email. Once we close today's session, the recording and PowerPoint will be made available on our website. I'd be more than happy to send that out to the group. And then, as we've mentioned, please make sure you register for next week's session. That is a 2-hour session, and all of our 2-hour sessions in this training, you will be receiving 2 NADAC CE hours as long as you attend the training in full. So I just want to say, Ashley, there's a lot of thanks and praise in the chat for you. People are loving all the information that you shared. So I'm really excited to continue this conversation, and we hope everyone can join us next week. It doesn't look like we have any questions, so we'll end it there today, and we hope to see everyone on our October 8th session. So thank you all for being here today. Bye now.